Dr. Pelto here. I want to talk a little bit about something called an ankle foot orthotic, and I want to show how they differ a little bit than a regular foot orthotic. A foot orthotic is something that you can buy at the store. Your doctor can make that only goes in the bottom. Sometimes we need to go up the side of the ankle, and that's where it's called an ankle foot orthotic. It looks very similar to a brace, like an ankle brace. And so let's go over, there's a lot of indications for these types of braces. There's a lot of different names of these braces that you can look at. For different reasons, some on the inside of the ankle, outside of the ankle, things like that. So let's talk about the typical questions. Why do I need an ankle foot orthotic? Basically, if you need more support than a regular orthotic can give you. Also, if a regular ankle brace doesn't work, or if you want to try to avoid surgery for a condition where you need more stability of your foot. Can I wear them in all my shoes? Well, that's a big question. A lot of times the shoes may need to be modified, going up a size or even taking out the liner, and I'll show you that and how long will they last. Let's talk about shoe gear. You're going to have to take the sock liner out. This is this little thing under the shoe that has the name of the shoe written on it. This should come out. Sometimes it has a little bit of glue, but if it doesn't come out or there's no glue, you're going to have a hard time using this for the brace. Also be aware that the brace on the side of the shoe here, it's actually going to stretch it out some, so that's pretty common. So you're going to have to go up a little bit in the size and have something with a sock liner that comes out. Will my insurance cover them? Some insurances we know will cover, some won't cover. Medicare tends to cover at 80%, and your additional insurance will cover the other 20%. It's best to check with your insurance. That's the best way. And usually they're covered every 5 years, unless there's a change of your foot diagnosis or a need for it. How are they sized? We use something called a STS sock, and we put this along your foot, and it's made specifically to your foot. There are new 3D scanners that can be used now, and we're using those a lot of times too. Let's talk a little bit now about the different types of the braces. This is one called the posterior tibial brace for the posterior tibial tendonitis. The posterior tibial tendon runs down here along the ankle and it inserts right around here. It can become inflamed. It can become torn. It can develop arthritis in the foot. It tends to be seen in a very flat foot, and this is a type of a brace. This is one type that gives you support. You notice there's this little fabric area on the side. This allows this area to push out and not get injured or aggravated. Tends to be used for something called posterior tibial tendon dysfunction or tendonitis or excess pronation. Another type of a brace called the Optima brace is very similar. It can be used as well for that pronation or posterior tibial tendon dysfunction or ankle instability. A lot of these braces can be used for multiple things. So these can be used for other things, and we'll go over that as well. A drop foot brace, this is a brace if you have a foot that drops down, if you trip over your toes, if you've had a stroke, if you've had another issue where you can't lift your foot up like back surgery or back injury. This type of a brace has these little plastic inserts that when you put the brace down, it pops right back up. It has a spring mechanism in it. That's one type of a brace for drop foot. Another one is called a Paramax brace. It has a little Velcro thing that goes up top. Carbon fiber that goes around the foot, and there's a little flat plate. This one doesn't bend like the other one that we saw. It's made out of straight carbon fiber. It's used for drop foot. This is another type that's used for ankle instability. So if you have an unstable or you roll your ankle, this once again can give more stability. It looks very similar to an ankle brace. It has a little orthotic in here and then an ankle brace up the side. Another one is called a balance brace. This is made for older people or people that have a history of falls or use a cane or a walker. It fits in your shoe and it gives you more stability. It helps you feel where you're at, your proprioception. And it can be used for people with neuropathy or fall risk. It works better. You're still going to use your walker or your cane, but it makes you feel a little bit more stable. This is something called a crow boot. A crow boot is something, it's a Charcot restraining orthotic walker. And it's made for someone that has a Charcot foot. If you had Charcot foot, you're going to know it. It's a complication of diabetes where you break your foot and you keep walking on it and your foot collapses. This can be used. It sometimes needs to be modified inside based on your swelling level because it tends to swell more in the beginning and swell less later on. But this is a good type of a brace that can be used for you. Also for generalized orthotic arthritis, like I said before, these can be used for different things. So arthritis, for pain, for ankle instability, very similar brace giving you protection. If you want something a little more minimal, this is called a Meso brace, and it's only for the middle of the foot. So it sits right in the middle of the foot and helps reduce the movement in that area that can become painful. So these are used to reduce painful movement if you want to avoid a surgery. This is a piece of a larger brace. So the meso is a piece right here of this larger brace. So if you only need to restrict the movement right here, you can use that other one. If you need something with more restriction, you can use this bigger type of a brace because of arthritis. This is just a different fabric. This is a fabric that breathes a little bit more that you may want to consider as well. Here's a thermoplastic brace. This brace goes along the back of the foot. It seems kind of bulky. If you wear it with pants, you can't really see it. But if you're needing something this big, you probably don't care what it looks like. It can be used for people that have weak or absent dorsiflexors, arthritis, trauma, and they have instability on both the inside and the outside of the joints. This is one that made for kids. It has a couple of Velcro things, and it's like an orthotic, but it goes up higher and it gives more support. It's used for kids that have low tone or hypotonia, such as Down syndrome and other types of low tone issues. This is the last one we're going to go over. This is for lateral ankle instability, so a lateral ankle sprain. There's medial sprains where you flatten on the inside, or you sprain on the inside or sprain on the outside, and there's different types of braces for each of these. This tends to be more common in a high-arched foot or a cavus foot. So that's some information about ankle foot orthotics. I hope you found this beneficial.